If you're watching this and you've been told that you need ACL surgery, there's a very good chance no one has told you the most important part of this process actually starts before the surgery ever happens. And that's a problem, because the majority of people are rushed into ACL surgery with a swollen knee, weak quadriceps, poor motion, and zero real preparation. Then they're surprised when rehab progress feels slow. Today I'm going to show you exactly what you should be doing before ACL surgery, why prehab matters, what the research actually says, and how, in some cases, this phase can help people avoid surgery altogether. Prehab isn't just a few exercises before surgery. It's the foundation for everything that comes after. Research consistently shows that having a strong, mobile, and calm knee before surgery has a positive impact on how you feel after surgery, how quickly you progress, and how well you ultimately recover. One of the strongest predictors of post-operative knee function is preoperative quadriceps strength. The stronger your quad is going into surgery, the better it will likely come back after. And quad weakness isn't just about short-term recovery. It's been linked to higher re-injury risk and higher rates of osteoarthritis down the line. Arthrogenic muscle inhibition takes a massive toll on the quads, making it very difficult to contract your quad muscle in the early stages after surgery. Ask anyone who's had the surgery already. Getting a head start on familiarizing yourself with foundational exercises beforehand can be a game changer. So if we're not addressing this before surgery, we're already behind. Prehab isn't random, and it definitely isn't just doing a sheet of exercises. There are very specific goals that we are chasing. The overarching goal of prehab is to restore a quiet knee. That's a knee that's calm and prepared to tolerate training. Let's break down what this includes. The first goal is to get the knee to calm down and reduce swelling. Ideally, we want a knee that has minimal to no swelling before surgery. An overly swollen knee makes restoring range of motion and quad strength difficult. And if your knee is really swollen and stiff going into surgery, the recovery can be a bit tougher on the other side. The second goal is to achieve full knee extension range of motion and full or near full flexion range of motion. Restoring this will allow for better quad control and improved walking mechanics, and also it's a positive indication that your knee is progressing in the right direction. Next up is restoring quality quadriceps activation. This is huge and often missed. Before surgery, you should be able to, at minimum, perform a straight leg raise without an extensor leg and walk with appropriate gait mechanics. If your quad isn't firing well before surgery, it will be even harder to wake up afterwards. In addition to this, ideally we want to build real strength before the operating room, with your injured leg reaching a quad strength metric of at least 80% or greater when compared to your non-injured leg. Now that number isn't random or arbitrary. It's associated with better outcomes after reconstruction. And last but not least, this injury isn't just physical, it's psychological. Prehab gives you time to process what happened, work through frustration, fear, or anxiety, and mentally prepare for the work ahead. For some people, this means simply just regaining confidence with walking normally again. For others, it's understanding what rehab will actually require so surgery doesn't feel overwhelming. The goal is to have a positive outlook on surgery and set the stage for a successful recovery. This is a great time to connect with a mental health professional if needed. Education and understanding the recovery process is key. Here's where things get interesting. A recently published paper states that findings indicated that there is no certain evidence that ACL reconstruction for an isolated ACL tear is superior to non-operative treatment. Clinicians should consider non-operative treatments with a well-designed rehab program as a primary option. Now, it's important to note that there are many contexts to consider. Are there other injured structures? What level of activity are you looking to return to? How much instability is there? And more. Additional high-quality research is definitely still needed, but that doesn't mean surgery is wrong. But it does mean that counseling should often start with non-operative management first, if appropriate. Trying to prehab first does two things. You either go into surgery better prepared, or you realize you can function at a high level without surgery. Either outcome is a win. Now, there are situations where waiting is not appropriate. Certain meniscal tears, multi-ligament injuries, neurovascular compromise, and also timing of life events. A college junior, for example, might opt for quicker surgery to be able to participate in their senior season. A parent might opt for quicker surgery to be able to walk and dance at their child's wedding. This is why it's a conversation that you should be having with your surgeon. First up is activity modification. Early after injury, it's often a good idea to limit excessive time on your feet, avoid pivoting, jumping, and high-impact activity, and use crutches properly. This isn't about doing nothing. It's about doing the right things to facilitate healing. This phase is temporary, but doing too much too soon often backfires. Number 2, restore knee range of motion. Your goal is symmetry to your non-injured side for both flexion and extension. Exercises like quad sets, bag hangs, and heel slides are solid choices. You want your knee moving normally before surgery, not learning this for the first time after. For a full breakdown on restoring range of motion, check out my step-by-step guide. I'll link it in the top corner and also in the description below. Number 3, regain quad control and strength. This will vary person to person on what is appropriate, but common exercises include quad sets, knee extension isometrics, terminal knee extensions, leg press, and step-ups. These need to be progressed strategically. Remember, the goal is 80% or greater strength symmetry, not just feeling good. Number 4, restore normal walking mechanics. This means proper heel-to-toe sequencing, appropriate quad control during mid-stance, and not limping. Learning this before surgery makes a massive difference after. Number 5, manage swelling correctly. Yes, ice, compression, and elevation help, but here's the key. No amount of ice will fix a program that your knee does not tolerate. Swelling should be trending down over time. If it's not, the plan needs to change. For a full breakdown, I'll also link my knee swelling video in the description. Number 6, last but not least, test the non-injured side. This is one of the most overlooked steps. Testing strength and hop performance on your non-injured leg before surgery gives you a true baseline. After surgery, both legs decondition. So side-to-side comparisons can be a bit misleading if you don't know where you started. Research shows this gives us a much better indicator of progress later. Prehab shouldn't be viewed as optional. It's an opportunity to improve surgical outcomes, or in some cases, avoid surgery altogether. If you're being rushed into ACL surgery without addressing these things, you're missing a critical piece of the puzzle. If this video helped, make sure to like, subscribe, and check out the linked resources below. And if you want help structuring prehab the right way for your specific situation, that's exactly what I do. Book a free call with me using the calendar link in the video description. I'll see you on the next video.